All right, we're going to get started, I think. We're 1 minute early, but we'll get started nevertheless. Thank you for joining us for this edition of the ICI Policy Forum. The topic today is based on the latest edition of the Policy Research Brief, PRB, as we briefly call them. That topic is predictors of annual turnover among direct support professionals. My name is Julie Bershadsky. My preferred pronouns are she, her. I am a white middle-aged woman with short black hair, wearing a checkered shirt and a green bandana, very festive, around my neck. I am sitting in my home office and have shelves of books behind me. I'm also the Director of Community Living and Employment at ICI and Student Community Integration. Facilitating this conversation with me today is Quinn Oteman, my colleague at ICI here. The research that we'll be talking about uses National Core Indicators staff stability data. It's the first study of its kind to try to look at both organizational and state level factors as predictors of DSP turnover in organizations. We are very excited to have James Houseworth, also ICI. He's the author of the study as one of our discussants today. Also joining us is Amy Hewitt, the director of ICI, who has a wealth of knowledge related to these issues and can put it all into perspective like only she can. With that, I'm going to pass it on to Quinn, who will walk us through the PRB, starting with the research issue and the study background. Quinn, on to you.
Thanks, Julie, and thanks everyone for being here today. So as Julie mentioned, this research issue is to analyze DSP annual turnover. And this study that we're highlighting today is the first of its kind, like Julie said, to use National Core Indicator data to analyze state and organizational level factors to look at this issue. So that's a brief synopsis of the research issue, and you can move on to the next slide, please. So again, the study background, this uses the National Core Indicators 2016 Staff Stability Survey data. NCI is an initiative of the National Association of State Directors of Developmental Disability Services and the Human Services Research Institute. So this data was collected in 20 participating states and the District of Columbia, and it represents over 1,600 agencies providing direct support services to adults who are living with IDD at that time. Next slide, please. So before we move into the key findings, I just wanted to ask James Houseworth, the author of this study, to explain a little bit about how we conducted the analysis and how to interpret the results and numbers that we'll be talking about in this brief today. So I'll briefly turn it over to James.
Thank you. As Quinn mentioned, we used both organizational and state level factors to look at this. And the analysis we did was called HLM, which is a hierarchical linear modeling. And basically what that does is we have a series of organizations. So we were able to look at how differences between organizations relates to turnover. Then we were able to put those organizations in the same model and basically cluster them or nest them, however you want to put it, within their state that they're from. And we were able to look at above and beyond those organizational differences, how state differences affect turnover too for those same organizations. So that's it's a fairly sophisticated model, but that's the kind of easy way to put it. And what you get out of that for each factor, for example, wages, at the organization level, the average wage, or at the state level, how much they're spending on Medicaid, as an example, you're able to get what's called a coefficient, which tells you how much an average change in a wage affects turnover, and how the average change in spending affects turnover. So you can, one more thing I'll say before I turn it back to Quinn. Basically, since all of them are together in the same model, you can also interpret these average changes in wage that affect turnover above and beyond the other variables we included. So it's not just that we looked at wage compared to turnover, it's actually controlling for other factors. So.
James, before we move on, can you just briefly remind us what some of those other factors were that you controlled for?
Yeah, it would
If
be
you
like,
remember off the top of your head.
yeah, let me, yes, give me a second here. So for example, it was wages, whether or not they offered paid time off, the number of overtime hours on average, whether health insurance was offered, and the percent of part-time employees. And then we also controlled for their overall vacancy rates, the number of service types the organization offered, and their staff size. So those were the kind of variables we controlled for.
Okay, great, thank you.
Mhm.
Quinn?
Yes, thank you so much. That's super helpful for us to all understand your process. Okay, so now we're going to kind of move into the key findings from his study. And just as a reminder, how this is going to work is we will talk about 4 key findings in total. The first 2 are going to be organizational level factors, and then the last 2 are going to be state level factors. Then after explaining each finding, I'm going to ask Amy and James some questions, and then there'll be group discussion at the very end. All right, so you can move into the next slide, please, Julie. Okay, so the first key finding that we wanted to highlight from the study was that for every $1 increase in wages is associated with a 1.10% decrease in DSP annual turnover. So based on this finding, we have a question that is going to be posed to both Amy and James. Either one of you could go first. So clearly, wage increases are effective. So what are the limiting factors in raising DSP wages?
This is Amy Hewitt. I'll jump in. I'm the director of the Institute on Community Integration. I use she, her pronouns, and I'm sitting in my new office at the MIDB building. That's very exciting to those of you who know ICI and our previous location. And I have in the background of my screen a University of Minnesota sign with some green hydrangeas kind of surrounding it, and am wearing a dark hooded sweatshirt and have long brown hair. So in response to Quinn's question, you know, the ability to increase wages in nearly every state is tied to rates, and rates are tied to elected officials. And so some of the biggest challenges and barriers are convincing elected officials on the need to appropriate resources that then are matched depending on the state you live in at varied levels. I use 50% because it's a good middle ground, but all states' programs are funded primarily by Medicaid resources. The federal government matches what states put in. And so the bottom line is it comes down to politicians, elected officials, and their willingness to give an okay to increasing expenditures at that state level. So that's probably the biggest factor that I think serves as a huge barrier. And part of that barrier is they also often hear from the businesses, the providers, typically nonprofit and for-profit non-governmental agencies that deliver services. They're advocating for increases, as are disability advocacy type organizations. But often, because the fiscal notes are so large, and because we go back every single year asking for more resource, it just becomes, it's politicized. And that, I think, is the biggest challenge. That would be my response. I turn it to Quinn for anything else he has to add, or to James.
Thanks, Amy. I think I'll pass it over to James.
Yeah, I would just echo all of that Amy just said, and just add to that in the larger picture, and even with nursing homes and some other types of services like this, how you can decrease overhead cost and administrative cost and get more of the money into direct services for people with disabilities is a challenge balancing that with the need for there to be some overhead in, monitoring and safety protocols, how you increase the percent that goes to direct services without compromising other aspects of care. Is innovative ways to do that would be something to consider, and they are difficult to do.
I'm going to also add one thing, just based on a couple of conversations that I had earlier. There may be this additional factor of beyond political will or lack thereof. Also, this factor that rate setting methodology and how it's set, not a lot of people actually understand how that happens and how that is done, and it potentially can get carried over and renewed without real understanding of its impact. So it may be that, at least in some ways, it's not just a lack of political will, it's also a lack of sort of understanding and willingness and time to review and try to reset in those calculations. Just my 2 cents.
Julie, this is Amy, and one thing that I would add to the whole rate setting methodology that makes it difficult, particularly in services supporting people with intellectual and developmental disabilities, is that often the companies that are hired by states to do those rate setting studies and come up with recommendations are forced to rely on Bureau of Labor Statistics to look at occupations and what the kind of going wages are, what the prevailing rate would need to be to cover those costs. And the challenge is that there is no occupational code for direct support professionals within the Bureau of Labor Statistics. So they often will use personal care assistant and home health aide. And those aren't exactly the same positions as a direct support professional. So while direct support professionals do all of the things that a home health aide and a PCA does, they also do a lot more than that. And so depending on the rate study, it could be starting from kind of the wrong assumptions about the role of this workforce and the educational level of this workforce, et cetera.
Yeah, it's a very good point. Thank you.
Thanks.
Okay, before we go to the next key finding, I just want to ask Nick if there's anything in the chat, since I don't want to.
There is one from Olivia Sullivan. Would it help to put on a rate setting methodology training for state officials? Just thinking out loud.
Yeah, I was just in the process of replying to Olivia's comment, so I'll delete that. But, I think our elected officials are expected to know a whole lot of very sophisticated things, from, literally pig farming to health-related issues to rate-setting methodologies in long-term care. And so they do need education over time, particularly if they're new. You wouldn't expect that an elected official can know everything, so it certainly couldn't hurt.
Amy, is it okay if I pop in?
Sure. Oh, hi, Lynn.
Hi, Lynn Megan, provider, and have dealt with many of these rate settings for a long time. So at the risk of further complication, further to-dos with it, there's also all of the rate methodologies have to go through CMS, the Centers for Medicaid and Medicare, for their approval. So it gets that one more complicated basis. We try as best we can to educate lawmakers to the rate setting process. I believe in Minnesota, our best person who has the most knowledge with our current rate setting is Kevin Goodnow, and he does his best to educate legislators as best they can to the whole process with it. I would say the Department of Human Services attempts to do that with legislators, but they get so much in the weeds with it. So it becomes really complicated then as a part of that as well.
Thanks, Lynn. It's definitely complex and complicated.
Quinn, you want to continue on?
Sure. Thank you so much for that input. I think that that's all been really, really helpful for everyone to hear. So the second organizational level factor that we wanted to highlight is that when organizations offer health insurance, there's actually an association with lower DSP turnover in general. So I have two questions. So the first one I'll point to James, and I'm wondering if you can talk about what you found in this study in terms of the effect of offering health insurance to DSPs.
Yeah, thank you, Quinn. First of all, just keep in mind, there was kind of a little bit of mixed results because we looked at both early turnover and overall turnover across the year, and there were some differences. So this related to early turnover, kind of keep in mind. So it's also the thing to keep in mind, this is not uptake. So we don't really know if these employees or what % of employees within a provider actually are receiving health insurance via working as a DSP within these organizations. So, so yes, and thank you, Amy. I see that in the chat. Early turnover is within the first 6 months, correct? So to be refined there. So one of the things to keep in mind, early offering health insurance may be an incentive earlier, given the lower wages, because it may be a reason to think that, down the road, this could be something I might qualify for or choose to take. And that might be a very good incentive, but over time, given the lower wages and the complications with employer-based health insurance, people may not be taking this up via the provider. And so it may become less of an incentive over time for DSPs to stay on. So it may be something that incentivizes them early on, but doesn't keep them ultimately down the road. So wanted to make that clear.
Thank you.
I wonder,
Go ahead.
sorry, just to follow up on that, James, I wonder, just the thought, I wonder how much of this may have to do with the actual cost of that health insurance that people are. So once people find out how much it's actually going to cost them, it may become it may no longer be an incentive.
Exactly. That's why it may be an incentive earlier on, but exactly once you consider with your wages and so forth what it's going to cost, it may no longer function as an incentive in that manner.
Interesting.
And this is Amy, and one thing I would add is in most of our research, we have found that very low percentages of direct support professionals actually take up, even though they're eligible, a very low percentage, it's well under half, actually have the benefit of health insurance. They're offered it, but they can't afford, or for other reasons, many are actually eligible for government subsidized health care, so they buy into exchanges, but a pretty low percentage of the DSPs in organizations actually take up health insurance. It's one of the indicators that we work with organizations to monitor over time, because if it's not a benefit if it's not used, if it's not affordable and they're going elsewhere for insurance. Another assumption that people make about health insurance, particularly policymakers, is that if a DSP isn't taking up health insurance, it's because their spouse or significant other, they get it through there. Our research hasn't shown that either. It's typically because it's not affordable and they're more often getting it from some government subsidized exchange.
Thank you so much. Oh, did you have something, Lynn?
Sorry, yeah. And unfortunately, it'd be interesting to know what percent is, but there are a percent of direct support professionals who actually qualify and get their insurance in Minnesota through MNsure.
Yeah, that's what I mean, Lynn, is that's what I mean by government subsidized programs like MNsure in other states and all over the country. It's quite a high percentage. I can actually send you a study we did in Minnesota, Lynn, that actually says where the DSPs are getting their insurance, because I'll put it in chat actually while we're talking.
Thank you.
There's also a question in the chat that says, what is the percentage of DSPs getting their health insurance from elsewhere?
So it's related to what I'm talking about, Quinn. I'll put this report in chat.
Okay, thanks, Amy. James, did you have something to say?
I was going to add that one of the reasons we included at the state level whether a state was participating in Medicaid expansion for this very reason. We thought perhaps states that were would have retained employees because of this issue, because they're getting it via, and so you're able to do more things to get people like DSPs into government-funded healthcare via Medicaid expansion at a state level, but that did not seem to be related to turnover. So just to follow up with that.
Thank you. Amy, you're unmuted. Did you have something more to say?
No.
Okay. Then the second question that we have is sort of interrelated. So, and it's also a bit double-barreled. So can you talk about the relationship between offering health insurance and quality of work life for DSPs and how that affects the DSP workforce in general?
So this is Amy. I'll take a stab at it, and then James can talk. You know, we recently released a 12-month follow-up study to COVID-19 and DSP experiences around COVID-19. And there were a series of questions in that report that asked about DSP health and wellness, their mental health, and there are really concerning results. And so we know that this workforce is lower income. We know it's predominantly women. We now have quite sufficient evidence of some of the health and wellness related challenges that the workforce faces. So it's a group of people who really need preventative health care as well as acute health care, and in some cases, long-term care. And so to me, the importance of affordable health insurance benefits that they use is really critical. That study also, I don't want to get us off on a tangent, but it was a national study that showed 26% of the workforce is still not vaccinated, and yet they're working in situations that put them at very high risk of COVID-19. I'll get that link into chat too, so people can see those data findings. But to me, it's a very high risk profession, and that's all the more reason that affordable, accessible healthcare is necessary.
There's a comment in the chat asking about data offering or about childcare for DSPs.
Yeah, it's critical too. COVID-19 really, I mean, it was critical before COVID-19 pandemic hit. The study that I'm going to put a link in chat gets at that a little bit in terms of reasons people have left the profession over the last 18 months, and a significant number of people have left due to childcare issues and schools being closed or being asked to work at a schedule where their kids didn't have childcare. So it's an important benefit too.
I'll also just add on to that and say that childcare was one of our policy implications on our last research brief, as we talked about implications of DSP workforce and COVID-19, kind of in line with what Amy was saying.
Right, I think we'll move on to state level factors now, right? Next one is going to be the first state level factor that was found significant. Quinn, back to you.
Yes, thank you. So the third key finding, which is our first state level factor, you'll have to switch the slide, I think.
I did.
I'm still seeing health insurance on my end.
You are still seeing health insurance? Are others still saying, oh,
Yep, me too.
well, I'm
We're
not
having
quite
some-
sure what to do about that.
Some tech issues before, so sorry about that.
Technical issues.
If you try resharing it again, it might
My-
work.
My laptop is unfortunately frozen.
Okay. I believe I have the slides handy, so I could pull them up.
I'm going to
moment.
try to put myself back in operation as soon as possible. Sorry about this.
No problem.
Well, while we're waiting, I'll just say we're about to talk about individualized settings within a state. And that includes people that live in individual, like their own homes or apartments, or small group homes. And this is from our risk data here at the University of Minnesota. And it's basically people that don't live with family or in organizations that are larger than 16, or in institutional settings like ICF. So these are people that are more in the community, kind of on their own. That's why it's called individualized settings. So we're going to talk about how many people live in those kind of settings per state and the effect of that on turnover. So
Thank you. I do have the slides pulled up, Julie, unless you're ready to go. I can just share my screen.
I am not, I'm completely frozen. I can hear you, but I cannot see or show anything. So if you can take controls, that'd be awesome. Sorry.
Yep, you just
about
have
this.
you have to give me screen sharing capabilities, so I'm able to do that.
Nick, can you do that? I'm unable to do anything at the moment.
You should be okay now, Quinn, to share.
Okay. Perfect. Sorry about that, everybody.
When we've grown used to it over the last 18 months, we're quite conditioned.
That's very, very true. Okay, so you're seeing the start of this, correct, everybody?
Correct.
Okay, let's get to that third key finding that James kind of debriefed us for. Here
There we
it
go.
is. Okay, so I can no longer see my script, but I can talk about this finding. And essentially this is saying that as people with IDDs are living in individualized settings, as that rate is going up, there's actually an association of a decrease in Dsp turnover by 7%. So let's see here, whoopsies. So I'm wondering if James, maybe you could first talk a little bit more about that. I know you already debriefed us.
yeah, I mean, we also found this in another analysis with the choice making, the ability to make choices about your own life and some of your services. We found a similar effect that the more a state had people living in individualized settings, the more the people themselves with IDD reported being able to make their own choices. So, you know, there's a few reasons for this. I mean, we don't know the cause of it, but one possibility is that the quality of, at least for turnover, that the quality of work may be better in these individualized settings. So that's, you know, despite the wages, so this is above and beyond wages, right? So despite lower wages and some of the healthcare issues we talked about, people may be staying longer and more likely to stay because the quality of work is a little bit better than being in an institutionalized setting. Even though we didn't have a measure, the other thing to keep in mind is we didn't have a measure of support needs here. It may be that states that have more people living in individualized settings, those have less support needs in those individualized settings, so that decreases turnover as well. And the last thing I can think of, states that support more individualized living they may have a kind of disability culture that promotes more independence, and they may just have a culture that values the work of DSPs a little bit more. That's unclear from our findings, but that could be another reason why increases in individualized settings are having people stay a bit longer.
Thank you. Let's see here. Oh, there was a question in the chat that was answered. Okay, Amy, did you have anything to add on that?
I would just, Kirsten asked a question, how many in small group home? I defer that to James. I think that the Residential Information Systems Project defines that as less than 6. But can you confirm that, James?
Yeah, and it's the percent living in, give me 1 second here. People living in large settings on this survey was, on this risk data was 18%, individualized 31%, and with family was 48%. So the ones living in the individualized settings across the country on average was 31%.
But the way small group home is defined is fewer than 6 people, correct?
Let me see here.
Andy would know that too.
I think it's 1 to 3.
Okay, yeah,
Yeah.
that's a big difference. So thanks for
Yeah.
clarifying.
Quinn, before you go on, just so you know, I'm back and fully operational, but I'll continue. I'll let you continue run the slides, and I can monitor the chat too.
No problem. Yeah, I am good to go. Thank you so much. I'm glad you're back. So I did have a question related to this specific finding as well. This is for both Amy and James. What does the relationship between individuals with disabilities living in individualized settings and lower DSP turnover mean? You kind of spoke a little bit about it, but if you have anything more to add, I'm sure they'd love to hear.
This is Amy. I'll take a stab. When you talk to DSPs about why they stay in an organization, and even when we do focus groups with DSPs about what are the issues, what are the challenges, it all comes back to they do this work because of the relationships that they have with the people to whom they're providing support. And those relationships, I think, are much more individualized and personalized in a smaller environment where you may or may not have, quote, shift staff, where you're maybe even in a shared living situation and you really are getting to know the person. That commitment to the person and that relationship is really what motivates people to stay in this job. If you interview stayers, the half of DSPs that sort of choose this as a career and are there for a very long time, and we don't talk about that group of workers enough, but I think that's the biggest factor is it comes down to that relationship and really getting to know people and being very committed to them.
Thank you, Amy, so much. James, did you have anything to say about that, or should we move on to the next key finding?
I think we can move on.
Awesome, sounds great. Thank you so much. So then that brings us to our 4th key finding, which is a state level factor. So essentially, this is telling us that for every $100 increase in per capita Medicaid spending, there's an association with a 2% decrease in DSP turnover. So I have 2 questions. First, we'll start with James. Can you talk about the relative effect of increased per capita Medicaid spending?
Yeah, so to put this in perspective, what this slide is saying, the average per capita Medicaid spending in the US is around $160. Some states go up as high as, I can't remember the range, but there's some, I think like New York or something is in the 300s, something like that, but on the average is 160. So if you increase by $100 nationwide, that would almost double the per capita Medicaid spending. So that's one way to kind of understand what this means in actual practical, pragmatic terms.
Thank you. And the second one that we have is for both Amy and James. Based on this, is more money enough to decrease DSP turnover? And what else could be done?
I'll take a first stab at answering this question. Money matters. It does matter. Wages are critically important. It's ironic to me that I think this will be this is based on the first peer-reviewed study that actually connects wages to turnover. So nobody disagrees with that. My work inside of organizations, though, and in looking at some states that have the highest wages, it's not the only thing. There are huge components of organizational culture that matter. There are huge components around onboarding and making sure that you're hiring people who really understand the work that they're getting into and what it will take to be successful at that work. So wages are critical, benefits are critical. This study shows that very clearly. There are other factors that matter too. So it's a little short-sighted to just say, well, let's just double the amount of money we're putting into these systems. It won't totally solve the problem.
Thanks, Amy. Did you have anything to add, James?
Yeah, it's not just it's the money, it's how it's directed to. So states can do very different things with how the increases in money. And that doesn't necessarily directly go to things that would decrease turnover. Just to keep in mind, there's also the factor of how states and organizations spend that money.
There is a question in the chat from great persons. If by Medicaid spending, is that specific to Medicaid spending and HCBS? And I believe, James, correct me if I'm wrong, I believe this is just total per capita Medicaid spending, not separate for HCBS. So
yes, it's
overall.
HCBS and ICFs within the state for that population. So includes both, yeah.
So it's total.
Thanks so much. And so that brings us right into our policy recommendations. So these policy recommendations, I will say, are not exhaustive, but these are the things that we came up with in relation to these key findings. So essentially, wages for DSP workforce need to increase to equate their skill level and make their livable wages in their community sustainable. This will just ultimately decrease DSP turnover. I wanted to also invite Amy, James, and Julie to comment on these as we go too. Does anyone have anything else to say?
Well, I'm gonna say this is just sort of a general observation. Every DSP that I talk to, when I talk, when I have asked what needs to be done, the first immediate response that does not require more than half a second is pay people a livable wage. It's until that is solved and until that is done.
Yeah, I would agree.
And just to add to that, we have done another analysis that's still under review for publication, where we kind of basically we looked at pitting wages against other types of benefits, at least the ones that we had, which include the health insurance and pay time off, and that was much more significant than other incentives, at least in terms of like tangible benefit and incentive kind of things, like offering pay time off. And another analysis looked at New York State, where basically they had access to information on nearly 100% of the providers, and that rose out of all the things that they measured to the top of those kind of incentives. It was wages that were the most important predicting their turnover rates.
And one more thing I'll add to this. When people talk about this, when DSPs talk about it, they don't, to me, it's interesting that nobody is asking for to get rich off of this, or to be paid in such a way that they can take vacations in Hawaii or Cancun every year or whatever, right? People are literally just asking for a livable wage, a fair, livable wage. That is what is needed.
This is Amy. A couple of additional thoughts that I would add to this conversation are, as we're thinking about some of the newer models of support, I think we really have to pay attention to this data around wages, as well as this recommendation is focused on wages, but we also have to pay attention to some of the benefits that matter, because in a lot of models like self-direction, shared living, those aren't readily available to DSPs, and we know they matter. So that's one thing that I would say. The other thing is, in this recommendation, we talk about cost of living increases, and it's the part of the policy advocacy over time that's the most frustrating to me, because when you look at wages and you adjust over time for cost of living, we've made no ground at all. And so all of our effort and energy is put into what should just be automatic cost of living increases that happen in state government, in lots of different places. Just in order to do business, cost of living is built into financial structures, and it's not in most states. It's not an automatic thing at all in this industry. That would be a big help. And then trying to get wages up to livable on top of that. But we fight every year just for not even close to cost of living increases, and that's the biggest hurdle.
So in Minnesota, in our rate form now and through statute, we do have that every 2 years, the competitive workforce factor will be looked at, and it will go back. It's 2-year-old information, and you're absolutely right. Our first problem was we never got up from the bottom in the first place, but going forward, at least we have a mechanism to move it forward.
And yeah, Lynn, that's great for Minnesota, but yep. It's not even close to that in most states. So it's absolutely, I mean, that was a huge victory in this state.
There are a couple of, sorry, go ahead.
We do have a comment. Do we have any information on the average dollar amount of livable wage?
Yeah, I just was looking that up. It's US nationwide, it's approaching $17. And just to put that in context, our DSPs in this survey are averaging about somewhere between $11 and $12 per hour. So it's off by almost $5, $5 to $6, which is a sizable difference if you think about it.
I've always said that we need a 30% increase. I mean, that's what's needed to bring us up to where we need to be.
That's about right. Yep.
Okay, thank you so much. We have 3 more.
There's another comment in the chat that I would actually like to read.
Go for it.
We can't hear you, Julie.
She seems to be frozen.
She's frozen.
But
yeah.
I can read it.
Am I back?
Oh, you're back now.
Okay.
Go ahead.
All right. Oh, technology. Okay. So the comment in the chat is from Nicole Murray, who says that I would argue that we need to pay people a professional wage. The work should not be devalued at a livable wage, but a professional wage. We desire to hire professionals, which is a very good point.
I agree with that, Nicole. I think we need to hire at a livable wage and build incentives through credentialing and career pathing to bring wages up to professional level.
Yeah, I would agree. I wanted to share too that when I was working in the direct support workforce, I wanted so badly to become registered and earn a professional title and to earn more, but my organization just didn't have the capacity because they couldn't offer me the incentive. And then my incentive then to become professionalized was like out the window because I had to like take off the work and it was already a low paying job. And then it just was this like cyclical cycle. So yeah, I really like that comment too.
All right.
Let's move on to the next one. We have 3 more. Thank you. So the second one is that organizations should be offering benefits in the form of health insurance and paid time off. And this kind of gets at to what I was saying and to our second key finding. So the structures need to align with an increased cost of healthcare benefits for DSPs to receive an option of affordable health insurance through their employer. And then if this happens, turnover will decrease. Do we have comments on this one before we move on?
James, this is Amy. I would just reiterate that some of the service models that we're moving to, or that some states are moving to, the paid time off is often something that isn't necessarily in all circumstances included in budgets for self-direction or shared living. And it's just it's an important thing to keep in mind.
Thank you. And it looks like our third recommendation made it onto this slide as well. So that's the second bullet point here. So this gets at states should continue investing in providing services and supports to individuals in smaller community settings and supporting people to move out of larger institutional settings to live in the communities that they desire. So as you saw in the third finding, when this happens, DSPs it has been associated with DSPs having a better quality of work life and a lower DSP turnover. So are there any other comments on this one?
Quinn, before you go on, there are a couple of also comments in the chat. One is from Georgina Schuster. What type of professional training and certification is available to DSPs?
Good question.
There are several. NADSP, but it's too expensive for small organizations, is a follow-up comment. And Joe Macbeth is on this call if you can chime in. That's also a comment.
Perfect.
Yeah, we'll let Joe, or I saw Desiree is on from NADSP too. That's certainly the one of 4 national credentialing programs or accreditation programs that I'm aware of in IDD services. The National Association on Dual Diagnosis has one, the ACRE and the APSI certification and credentialing programs also exist on the employment side. And then at that state level, there are a number that exist or are emerging in states. And many states, through their ARPA funding requests to the federal government, so how they're going to spend their American Recovery Program Act dollars, have identified credentialing as an activity that they would like to spend some of those resources on. So I think we'll see more coming soon, or maybe not soon, in the next 3 years.
Okay, I'm gonna run through a couple of other questions that are in the chat just because I think we should get to them. One is, does a PTO recommendation include part-time? Include for those folks who are working part-time?
James, you want to take that? Because I'm sure she's talking about analysis.
Yeah, I'm gonna wonder if Sandy remembers here. I know there were some issues with, I don't think it, I think it does, but not sure we can break it down by whether it was offered to only part-time or full-time, if I remember correctly.
I wonder if the question is more about whether our recommendation include providing pay time off for folks who are working part-time.
I hadn't thought about it that way, but since there's a pretty significant portion of people working these jobs that are doing them on a part-time basis, having some way, I mean, and this goes back to the health insurance thing and the childcare thing, and having some way for them when they need to take time off to not be, you know, these are low-wage jobs, they're kind of dependent on them, having some way for them to have some flexibility to get to a doctor's appointment, you know, when the child needs care, something, even if they're part-time, yeah, you would think would increase, or I mean, decrease turnover. So yeah, I would consider, I mean, I think it'd be important to include part-time people, in my opinion, yeah, in this field for sure. And I do see somebody noticed it is hard to provide because they're working such limited hours. So yeah, that is it would be tricky to do, but some sort of flexibility would be good.
One more question also, James, for you. As part of the findings of lower turnover in correlation to smaller community settings, people who were living in family homes, were they classified as small home individualized settings? No.
No. So that's a good question, because we found compared to family homes, individualized settings were having less turnover. Right. So it's, you know, compared to those types of settings.
Another question, have you compared the cost of services between community-based providers and institutions? Seems that should motivate states to spend less and get more. I will say to that is certainly well documented that providing services in institutional settings generally costs a lot of money. So
I will add to that, Julie, though that argument has been tried for 30 years since the inception of community services, and it's never really worked to drive wages up.
Right. So it's certainly known. It also seems that it is not a good motivator. One more. Are employment specialists considered DSPs for the purposes of the study? James?
I will say some, certainly. There's a day service category that includes people that work primarily in employment services. Yes. So some people are considered DSPs that are doing employment related job coaching and on the job assistance.
Okay. Thank you. I think there are a number of comments in the chat. Just in the interest of time, I think we won't read them all. I think we got to all of the questions though, and we will have discussion at the end as well, which is thank you for asking these questions.
Yes, thank you so much. We have one more policy recommendation, but I did just want to note too that one of our discussants, Amy Hewitt, has to leave at noon, so she'll be off in just a couple of minutes. So the last policy recommendation is in line with the state factors. So states should continue investing in Medicaid and home and community-based services, which will increase sustainability and at the same time decrease turnover, as more per capita investments lead to lower turnover. So just as it says there, this investment is going to have to include efforts to address the workforce shortages and retention challenges, and also the development of sufficient, stable, and a competent workforce to keep providing the supports to individuals with IDDs in the community. Amy, James, Julie, anything to add on to that?
I will say that, you know, one of the things that we hope about our work is that it's timely and useful. And as you know, there's federal policy being considered right now to massively increase funding for home and community-based services. I've lost a lot of sleep over that policy because at least in initial iterations, there was no attention to the workforce at all. That's changed and people are very aware of the need for it, but we cannot increase home and community-based services at the level of the investment that's included in policy drafts without having very significant workforce development programs and addressing wage, benefit, career pathing. All of those things have to be included, either embedded within that legislation or parallel to it. It's just critical. We just do not have enough people. We don't have pipelines. We don't have retention programs, and we don't have wages and benefit packages that sustain the workforce. So hopefully this, I see a number of people I know who are in policy advocacy roles on the policy forum today, and I'm hopeful that you will get this data and information in the hands of the key elected officials, because it's critical. We have to have it.
Thank you, Amy. So now that it's reaching noon, I wanted to just move into some of the group discussion questions, unless anyone has any final comments on this policy.
I do want to add one more thing about the expenditures thing that I don't think came up just yet. There's a high cost to turnover. So when you invest more in in some of this workforce development, it's not like that just is wasted, because there's a cost to retraining employees. There's a cost to hiring employees to these provider agencies that they're spending these federal dollars on. So that's another thing to kind of keep in mind, that this isn't just a one-way street where you decrease turnover and you're just paying for that. You're also lowering other costs related to this turnover, just to be clear.
That is an excellent point, James.
Yes, it is. I wanted to address one thing before we moved on about sharing the slides and content. Julie, did you have any clarification on that?
I believe that we can absolutely send the slides and the recording to attendees after this. It would also be posted on our website. The recording will be posted, and the PRB itself as well.
Yes, thanks for clarifying that. All right, thank you, everyone. So now we're going to move into the large group discussion. So feel free to chime in either in the chat or unmute yourself. So the first question that we have here is that in addition to increased finances, what other structural elements can reduce DSP turnover? So how can money be effectively invested into elements that could help reduce DSP turnover long-term is kind of our sub-question to that. Like I said, feel free to unmute or drop your comments in the chat.
Just to sort of, before we jump in, this is meant as an open discussion and an idea generating time. So as much as you want to or don't want to participate, it is entirely up to you, but we're really looking for ideas, thoughts, experiences, stories, anything that you want to share, that you can share.
Well, if I may, my name is Curtis Francis. I am with Humanum Inc. down in Maryland, Baltimore, Maryland. And, you know, I too started as a DSP. I'm now with training and development, still in the field of IDD. And, you know, years ago, 93, when I started in the field, I was a recent grad from college. And something I think that would have helped me, obviously, wage increases can help, but we know with the constraints, that's not going to happen. But one thing I know an agency recently enacted or implemented was a pay in advance, they called it, something like that. But, you know, pretty much DSPs had the option of getting a card, a debit card, and they could take an advance pay on the hours they've already worked. So there was no cost associated with it. So often in times, you know, we're waiting for that payday because so many DSPs are living paycheck to paycheck. It affects their credit score, which they can never get out of because they can never pay, you know, all their bills on time. So some have to wait till the next paycheck. And, you know, what this agency did was they put this together, and I'm so sorry that the exact name isn't coming to me, but pretty much the Dsps were able to sign on. They were given a debit card, and if they've worked 40 hours already, they could take an advance on that. In other words, they could cash that out and get that money in real time without no penalty to them, nothing to pay back, because this is the money they've already worked for. And I thought that was such a great idea because it helps in so many ways. And they can sign up if they never use it. It doesn't cost anything, but if that emergency comes along when they needed that money, they were able to cash it.
Thank you for sharing that, Curtis. So to me, that falls into the category of inventive solutions that providers can and do undertake. It is also quite tragic that those kinds of inventive solutions are what is necessary.
Yes, thanks. And there are a number of comments in the chat too. I don't know if you've been keeping up with that, Julie.
Yeah, I'm looking. So there are from Mary Lou Bourne, that seems that an important policy recommendation is for HCBS rate setting methodologies to include allowance for a full benefits package and a living wage based on the state's variable minimum wage. So back to the issue of how not just how much money, but how that money is actually being distributed, allotted, and invested. In terms of what can be done, some of the more common things in the chat are staff development and training, certification, credentialing. There's an interesting comment about supervisor. Leadership training is what's needed. Also leadership training on all levels of leadership. One of the main reasons that staff leave is their supervisor. Occupational code for DSPs.
There's another one about operational considerations down there from Michael. I just posted it.
Mm-hmm.
Yep. Consideration to most service providers. Yep. Nationwide to enhance wages for DSPs and create a tiering of wage evaluation based on skills. Yeah. Thank you.
There are 3 prevailing factors that inhibit the scalability: the base level of training, scalable professional development, and the lack of general recognition of DSP. Yeah. And there are artificial and non-market-based caps on wages placed by rate structures, either from CMS or individual states. Yep.
Yeah, I just am reading all of these too and really reflecting on how these could just really improve the quality of work life for DSPs. I mean, these are things that are that seems so basic that they should already have, but they don't. And so I just am thinking, wow, there's really good potential here to put some of these things into action and really improve their quality of work life.
There's another suggestion by Georgina Schuster. Thank you for that. This is really interesting. So a suggestion about making DSP training available for free in community colleges.
Mm-hmm.
Which is
yeah, I like that too. Making that community college really accessible for those that want to get those kind of on the ground skills. Mm-hmm. These are great. Does anyone have anything else to say on this? These have all been really great. Otherwise, we can move into the second discussion question.
Yeah, so this is Tabitha. I'm in the state of Alaska, work with Hearts and Hands of Care. We have a lot of IDD participants with our agency, and we do have a lot of turnover. One suggestion that I like to throw out there is to have the state provide all the required training at the cost of the state, and centralize that training so the agencies aren't having to pay those costs that are involved with employee turnover and also eliminate the man hours to have in-house trainers and instructors to provide those trainings for 1 or 2 people at a time for a full day course, and have them centralized at the state providing the training and covering those fees, so that the reimbursement that we get from Medicaid at the agency level could be invested more in DSP rates of pay and benefits if those costs are alleviated from the agency standpoint.
Yeah, it seems that in addition to wages, this whole question of DSP training and credentialing is and that it needs to be accessible and freely available. Not just have there be training, but have it be a kind of training that will allow for credentialing and have it be accessible for folks, free preferably.
Right.
Thank you so much. Yeah, very, very valuable. In the interest of time, let's move on to the final discussion question here. Thanks so much, everybody. The second one we have is, in your experiences, what other state level factors could be contributing to DSP turnover? And I know we talked a little bit about this in some of the previous comments, but are there any other additional ideas that you might have or have experienced that you have seen create this turnover?
And so this is Tabitha again with the state of Alaska with Hearts and Hands of Care. Currently, our state's background check system has been hacked several times, which caused a huge delay with processing applicants to have a clearance and able to work. The interim process was delayed because there was no backup system in place. And also the availability for the new required training, the national supported employment requirements that DSPs have to take in order to provide certain services not being available at all. So by the time we get a clearance or a provisional from the state of Alaska, employees are dropping off the hiring process altogether. So I think there need to be better systems in place to push people through at the state level so that they can work, because we're losing a lot of people that way.
I'm gonna read a comment in the chat because I think it's an important point. Back to the sort of the training issue for DSPs. Training is a great idea, but most DSPs are working 2 or 3 jobs and have a difficult time attending training. I think DSPs are leaving because DSPs are overworked and stressed out. Absolutely. To sort of to piggyback on that, I do think that a part of the solution to this is not just making the training available, relevant, and free, but also reimburse the time that people spend doing those trainings. So it should be part of your paid professional development. That's sort of my approach. My answer to that would be.
And in addition, after the training, they should be getting paid a little more because they are now trained. So that's a really big part of that too. Thank you for sharing.
Absolutely.
I think a piece of what she said was the timing, the time that it takes to do that. If they have several jobs, when and how can they have the time to be able to take the training?
That's right. That's a really good point. There's probably a way for providers to incorporate that training time into regular work hours.
It's really tricky, yeah, because that could be a solution, but then it's like, well, now you're leaving a gap in service. That's a really good question. Lynn, did you have anything more to say? I think I spoke over you.
Yeah, I think, it really is critical time right now for people. And there's so many staffing shortages that to be able to take that time away is one of the concerns and problems. So we just need to share that and keep that moving and going, like with legislators and everyone, to be able to say people are burning the candle at all ends at this point.
Indeed. Okay, I'm gonna go back to the chat. There are some comments on other state level factors that could be a contributor. A comment from Hope: punitive attitudes about incident reports. The DSPs are blamed for reportable incidents that can be expected if people who are being supported are living typical lives. Yeah, so the transference of blame is something that's, it also goes back to this issue of respect. Treat and respect DSP professionals as professionals. Punishment should not be a part of that conversation. Not in that sense.
Yeah, absolutely. And I'm just going down to, they're coming in. So see, drug testing for marijuana is one. Yep, that's an issue. And then Michael said state level factors and local factors in California are related to local minimum wages, slow onboarding processes for hiring based on fingerprint clearance and background checks, and the general competition within the total labor market. He then says organizations are not competing for workforce with other service providers, but fast food and retail. Yeah, so other similar earning jobs. Additionally, the recent levels of unemployment assistance has made a percentage of low wage workers more willing to not work. Yeah, I would agree with that. Because there's like, what's the incentive if the pay is still so low and the benefits aren't there? I mean, absolutely. I wouldn't want to be working a hard, like a physically hard and mentally hard job if the pay is low and the benefits are low. Yeah.
There's a comment from Shane that I want to bring up. Playing the blame game is a cultural issue that can be changed over time. Refer to the just culture philosophy. That is interesting. I was just having this conversation this morning with somebody about the just culture and how that can be a huge mechanism for change in organizations. I'm wondering if anybody wants to talk about just culture and how that can be, what that means for an organization. I don't know if Mary Lou is on, but.
This is Shane. I'm the one who wrote the comment, obviously, but you know, with just culture, it's all about, I think that one of the best ways to summarize it is when, you know, when that incident happens, instead of, you know, blaming the DSP and, you know, they get in trouble or they get written up, is to look at the factors around it and, you know, asking the question why 5 times. Okay, so why did this happen? You know, was it a training issue? Is it a policy issue? You know, a lot of times when you look at things, you know, the policies don't change over time necessarily, or the processes aren't right. And so when people are doing what they were trained to do, what the policy says, but it leads to a negative outcome, we can't blame the person for that. We have to blame the process, and then we have to fix the process so that it's better and it leads to the outcome that we want.
And Mary Lou put a comment in the chat about that. To thank Shane, thank you for mentioning the Just Culture framework. It does require that all aspects of the system aspire to a just culture, so that blame of DSPs is not the outcome. There's a comment from Olivia, look up the 5 whys. It helps to get to root problems. I'm going to look up the 5 whys.
Yeah, so am I.
So
Um,
Julie,
yeah, go ahead.
Hi, thanks, Quinn. This is Mary Bourne, and so glad the conversation has moved into this. It's I think it's a both and approach too. We have to make sure that wages and benefit packages are really equitable and fair. And I can't agree more with what Shane has brought up. And it looks like mine just moved a little further. Olivia has also mentioned the 5 whys. These are pretty common formal quality approaches. The 5 whys is a really common quality tool that really, thank you, Olivia, for putting the link in there. Just culture is something that we've got to make sure there are not inherent requirements in state reporting structures that encourage someone, so a person, to be held accountable for mistakes, errors, oversights that are built into the process. That's really kind of what just culture is all about, assuming that it's a process or a system failure first before we assume that it's a person to be blamed. So I think this is a really critical piece that DSPs are getting caught up in quite a bit.
Yeah, thanks so much. I wanted to just also comment, that reminds me of the idea of scope of practice and staying in your lane too. And trusting the integrity of your coworkers is what this sounds like to me too. And this kind of comes back to the issue of the professionalization piece and really valuing DSPs as professionals, because yeah, I think what you were saying is just making me go down the path of, well, DSPs aren't really valued in their workplace as they should be. So I think this is really critical to start seeing their work as valuable, and it's really critical because it's directly impacting people's lives.
In Minnesota, there's, at our Department of Human Services, there's actually a work group working on looking at the safety and looking at, the reporting of it and how they are requesting that reporting and the punitive side of it. So how can they write the rules and regs to be able to be less punitive? So someone, on an organization doesn't lose their license because of a mistake. So what and how do you define mistakes? So there's not a lot that I always like about that our Department of Human Services is proactive, but I believe this is one of those proactive pieces that they're working on. So
that's really good to hear. Thank you so much. Let's see here. What else do we have in the comments? Did you see anything, Julie?
There's one more suggestion.
Okay.
What can be done? Stretch out training requirements so that staff can get on the job view of the position to see if they like it, rather than getting through all training to be compliant just for staff to find out it isn't a good fit. The employer is then all out of money and time to spend on training and background check. This, yeah, I agree. This goes to sort of realistic job previews, right? I mean, people should know what the job expectations are realistically before they make a commitment, just like with everything else. And I think that's just an important approach for every provider to make sure that a realistic job preview is something that they do on a just as a matter of everyday practice.
Yeah, it's a really good idea, because organizations obviously want to get people in the door and people to work for them because it's a really critical and important job. But we all know that marketing comes with a sense of unrealistic sense sometimes of what exactly the job might be. So, if like other DSPs could speak to potential new DSPs, or if there's like a video recording of something that typically happens in a day, or even like a task analysis of like a breakdown of a day of a DSP, realistically, would be really helpful. Yeah, thanks for that suggestion.
And that realistic job preview could involve shadowing, which is another comment that's in the chat just now. So DSP should job shadow before hire. That goes to a realistic job preview. It also part of the comment here, you should watch how the DSPs interact with the person with IDD. It'll tell you a lot.
Yeah, that's a really good point. And it also can teach those who maybe have a limited interaction with individuals with intellectual and developmental disabilities on how to appropriately interact with that population, and things to say and things not to say. So I'm a graduate research assistant at ICI right now, and I'm applying for a mini grant. And one of the things that I'm trying to change for myself is the language. And I think this is another important piece that could be learned to help improve quality of life. So like, instead of saying like problem behavior, we might use distress behavior, because they're only displaying a certain behavior because maybe that individual is really upset. So I think that that's a really important piece, because there's so much to be learned from shadowing and actually working with an active DSP at the time. So thank you for that comment.
So I think that the sort of the lesson from all of this is that it is important to build in good hiring practices as well. As difficult as things are, and as desperate, I think, as a lot of organizations are, we still need to think about how folks are hired, how they're trained. It's critical as well.
It is. Julie, there's one more comment I see from Linda. I don't know if we wanted to maybe read that and address it, but I do see we have one more question. Do you think we want to move to that one, or should we stay here?
Let's get Linda's comment out. Unfortunately,
Perfect.
adding the job shadow to the hiring process gives one more day that the person finds a job with Target. We do the job shadow, especially before COVID, but it makes the time frame to job offer that much longer. Yeah. So the point is, it makes it harder to hire, because people, your local neighborhood Target probably is paying just as much, if not more, as DSPs are right now. So certainly.
Yeah, thank you. And let's see if we can read one more. I'm going to read one more from Angela, and then we'll move on to the last one. So when I was the training coordinator, she says, I would meet with new hired staff and go over all the policies and have conversations about experiences that I had when I was a DSP. Sounds good. Then they would work in the group home for up to 4 weeks. Once a month, I would meet with all the staff hired over the past month to review the policies and discuss what they had experienced over the past month. And she says we had very low, in all caps, turnover during this time. That sounds extremely community-based, as I'm thinking in like research terms, because you're getting right down to that nitty-gritty and meeting with the direct support professionals and learning exactly what it is that they learned, liked, and disliked. Again, it seems like a longer process, but the way you had put it, Angela, is that you had very low turnover during that time. Yeah.
And that's actually a direct example of what just culture should entail. I mean, this is an example of how just culture should operate in an organization.
It is. I just wanted to reiterate that this is perfect what's happening right now, because we're bringing everybody together from all over to brainstorm about new innovative ways to kind of come up with answers to these questions. So I'm learning a lot as you're all putting in information on the chat and also contributing to this conversation. So I just wanted to say thank you for participating. There's so many more comments coming in, and I don't think we'll get to quite all of them, but I did just want to pose one last question in the couple of minutes we have left to gather some thoughts. And that is, how might we get DSP wages up realistically? So you kind of heard our thoughts on that and what the research has said, but like, what are your honest thoughts on this?
I can just talk. I participate with Anchor, a national association of providers, and we have a huge campaign. So a way for all of us is to, at this time, connect with federal legislators, Congress and senators, to the Better Jobs, Better Act that Amy alluded to, that is up for grabs right now in the House and Senate. We need as much money as we can from that to be able to move the federal participation dollars forward. So we all need to make that contact with our legislators at this point, because as Amy said, there's quite a bit of money that's there. We'd hope for at least a 7% ongoing federal participation match of the Medicaid dollars. So everybody make those contacts, please.
I would absolutely echo that. I mean, I think there's an action going on Capitol Hill right now where advocates and self-advocates are reading out their personal stories they've been doing for, I think, 24 hours straight, or that's the plan. It is extremely important for even non-political people to get involved at the moment and try to get these issues and the importance of these issues and the potential solutions across to people who may not know, to people who may not care, to people who may not know, may not have the time. But the more we talk about these issues in simple terms and the importance of that and how they affect really all of us, the better luck, I think, the better chance there will be that we can actually affect some change. Be the change that you want to see. Reverse strike, Terry Angel. Thank you. Yes.
Shane, I'm going to give you the floor, Shane, in just a moment, but Angela said this is the $1 million question, and I would totally agree. So let's keep brainstorming. And go ahead, Shane.
Yeah, I think one thing that I've learned in talking with our local legislators is sometimes they really don't understand the scope and the breadth of the services we provide. And I think in the back of their mind, they kind of look at it like, well, the restaurant, they just close the dining room and offer carry out, or you scale your hours back. And to help them understand that this is 7 days a week, 365 days a year, it's 24 hours a day that these services are provided. And if we're not here to do that, who's going to do it? What happens to these individuals when our agencies aren't around, or we don't have the staff to care for them? I mean, you have to close down sites, you have to maybe close down service lines. And so again, helping paint that picture for them of this is what we really do, and here's consequences of a failure to act on your part.
Yeah. So that's that discussion. One of the reasons why we started these policy forums and the short 2-page briefs that we went through is because we think it's a good, simple way to share information that can be, shoved in the face of legislatures when and if need be. So I think Quinn and I would encourage all of you who are on this call to use this information as much as you can. Both as discussion, but also the brief itself, it's 2 pages, can be printed out if need be. So just that last thought from me. Okay, Quinn, I think we can probably wrap up and say thank you.
Yes, absolutely. I'm just looking at the chat about sharing information. I think, can we just clarify one more time what that process is for people? Because I've gotten quite a few comments about the PowerPoint and recordings and et cetera.
Yes. Nick?
So what I would like to have happen is that you can go to the Policy Forum website. I will share that, and then those links and information will be there. However, I'm also going to email this out after the forum to everyone who registered. I have those email addresses.
Thanks, Nick. That's super helpful.
Yeah, thank you, Nick. Appreciate it.
Yeah, so thank you so much, everybody, for coming. This was a great conversation. I will move to the next slide. Julie's information is up there if you have any direct comments and questions about the brief. And you can also get in touch regarding the article used to make this brief as well. And if you're interested in this type of talk and you found this useful, these are going to be held every month, just about. So keep an eye out for one upcoming in, I believe, wow, it's already November next month. And we'll have a new topic to discuss all together. So thank you again, and we'll stay on a little bit until everybody is gone. Otherwise, have a great rest of your day.
Thank you, Quinn, and thank you everyone for attending. This is a great discussion. Appreciate it.
Thank you.